Thank you all for coming today. It's just a pleasure to be able to talk with you all about our medical center and some of the great things we have going on. Just to have all of you here is awesome to me because that means you have an interest in the medical center that serves all of you and serves all of our guests. So with that, I'm going to begin. I couldn't begin without saying a warm, wonderful thank you to Dr. Tom Steinberg, who passed away last year. But he was the founder of medical care in this valley. A tremendous gentleman in terms of everything he brought from medicine, how he brought more doctors in, and Jack Eck and Bill Bevan, and lots of folks who came to work with Tom. But at the same time, after he retired, he still did many, many, many good things for this community. He was a pioneer, literally, in healthcare, but he knew the community so well. He knew where things needed to be. He knew what land needed to be in land trust. So I would say a wonderful word in memory of Dr. Tom Steinberg. Thank you. So our mission at Vail Health is to provide superior health services with compassion and exceptional outcomes. And I can tell you we have a number of staff here today and administrators, and that's our goal every day when we come to work, is to strive to give that compassionate care and to meet everything that we do, all illnesses, all surgeries treated with exceptional outcomes. We've been in this community for 53 years, founded in 1965. We continue to be a 501c3 and independent. We have a wonderful board of directors. Dick Cleveland's in the back. He's one of our directors, and if I missed anyone else, I apologize. We have a wonderful board of directors who are voluntary, and they have a wonderful strategy session every year and talk about it at board meetings. Where do we want to go? Where do we want to be? And our goal is to remain independent. And the rationale behind that, and we can, economically, we can be sustainable and not have to be purchased or partnership in a formal way with any tertiary care centers or large systems. And the rationale for staying independent is that all the revenues that we would gain here on an annualized basis, those revenues stay in this community. They do not go to a health system in California, in Denver, in Minnesota. Everything stays here to turn back into services and employee benefits and employee salaries and hiring people to go in new service lines. It stays in this community. And we can make decisions very nimbly in this community in terms of new service lines that we bring in. We don't have to get permission from a hospital in Denver or from a system somewhere else in the country. So it's important to us. We have 12 locations in Eagle and Summit County, and we do accept Medicare, Medicaid, and TRICARE. I don't know how many times I hear from folks in the community, well, you don't take Medicare and Medicaid. Well, absolutely we do. As a 501c3 not-for-profit, we must take Medicaid and Medicare. And we choose to take TRICARE. Again, it's another government plan for our military. We have no intention of changing that. Some physicians in the private sector don't take some of those insurances. But if a patient comes to the hospital who has one of those carriers, in addition to any other insurance carrier or even no pay at all, we take all comers to our hospital. We have 965 local employees, and what that means is we have all of these employees and their families living right here in Eagle County, Summit County, Lake County, living and taking their living wage and putting it back into the community, whether it's in schools, whether it's at the grocery store or movie theaters or mortgages. We have those employees who actually work and live here as locals. We have 350 physicians and advanced practice providers. APPs are known as nurse practitioners and physician's assistants, but 350 physicians on this community medical staff. Is that pretty amazing that we have that? I wonder at that every day. It's great. So quality is our top priority. So to be able to serve and deliver exceptional outcomes, we have to have quality measures. We have to look at the work we do. We have to look at the services we provide. And not only do we hold the benchmark up to us, again, CMS, the Centers for Medicaid and Medicare, they rate every hospital in this country with a up to a 5-star rating. Vail Health has had a 4-star rating since the inception, where we were put into the pool of being rated. Now, as compared, UC Health in Denver they have a 2-star rating. So there's lots of things that we do really, really well here to rate up against the bigger organizations across the United States, but I'm proud of that. We have a patient satisfaction rate in the 90th percentile. That's all of you. Will tell you that how many of you have come for services at the hospital and then received a survey to fill out and send in? It's because of your feedback we can improve our care. So thank you for doing that. Don't put them in the trash. We're moving to a new service under Press Ganey where you'll be able to do it via email or even text. So check the next time you come in for a service. So thank you for filling those out. Our breast cancer survival rate is very high in Eagle and Summit counties. We have a 97% breast cancer survival rate in these 2 counties. It's absolutely amazing because the national average is 92%. Our prostate cancer survival rate is at 96%, which is 8% above the national average. So that's pretty darn good. We've received from a quality review standpoint from the Joint Commission that we're a pioneer in quality. Joint Commission is an organization that surveys hospitals on an every 3-year basis and accredits them based on the criteria and the standards that they lay on hospitals across the country. So we were amazed when we received that Pioneer in Quality Award. We have many, many other accolades from like the Women's Choice Awards, Best Hospitals for Obstetrics and for Orthopedics. So we're doing some good things here. I want you to know you're all part of that because you rate us in our satisfaction surveys and talks. I'm not going to go through this list, but this is an exhausted list of everything that we do, all of the services that we offer, either sponsored directly by Vail Health or in partnership. So our partnership with hospice is wonderful because with the Cancer Center, they work hand in hand together to take care of our hospice patients. We have just a number of things on this list, and I'm happy to give you a copy of that, and it's in some of our materials. But just know we have a very robust service line area. Our 24/7 emergency care. Now, I want to tell you that in this country, not all emergency centers are alike. So from our emergency center, emergency department here in Vail, we're a level 3 trauma center. So that means that our board certified ER physicians, our board certified trauma surgeons, and our board certified anesthesiology team, and all of our nursing staff and technical staff and clinical, they're ready to take care of any trauma that actually comes into our hospital. And it's pretty exciting because we do have to send some of our trauma patients out on an annual basis. We do about 75 helicopter and ground transports on an annual basis today of patients we can't take care of here. But I will tell you that our doctors are very capable and staff of stabilizing injuries. I think Jerry Greenberg's back there too. So Dr. Greenberg is a board member as well. But thanks to Jerry Greenberg and Dr. Prager, our 2 interventional cardiologists and electrophysiologists, we have saved a number of lives with our cardiac cath lab. And sometimes those patients stay, sometimes those patients move on. So I'm very, very happy. Our helicopter transport, as you know, we're relocating it over to the hospital, so that's exciting. For those lesser illnesses, so runny nose, sore throat, cuts and scrapes, we have our urgent care facilities. So the hospital's urgent care facility in Avon is located next to City Market. And we have another one located in Gypsum. Our Family Birth Center, we delivered 425 babies in 2017. That's down a little bit, actually, in our numbers. But we're still very busy. And our level 2 nursery means that any baby born at between 32 weeks gestation and 40 weeks gestation, we can keep them and grow them in our nursery here because we have specialized services to be able to do that. I talked about our cardiovascular center with Jerry and Nelson and Kelly Freilich. Some of you know her. She's a nurse practitioner. She runs the Coumadin clinics, the anticoagulation clinics. So wonderful, wonderful services that we can offer right here. Internal medicine, Dr. Lipton and Tanya Engel. Some of you have probably seen them. They manage several different areas, but internal medicine. And endocrinology, it's almost unheard of in a community of our size that we would have 1.5 endocrinologists. Dr. Rebecca Adocio is amazing. Many of you probably know her. She manages all kinds of things, from thyroid disorders to metabolism disorders to osteoporosis. Very, very good. And she actually manages patients throughout the mountain region. Dr. Melvin Sternholm is part-time, and he came up to the mountains to retire, but then a few years ago called and said, geez, I'm retired in Breckenridge, and I've only been retired 6 months, and I want to come back to work. So we were able to work out a very nice arrangement with him to see patients in Summit County in Frisco at one of our clinics there. And he sees patients from as far away in the state as Boulder. Surgical associates, many of you know them. So Dr. Schultz, Dr. Hamaker, Dr. Franchos, and Dr. Downey are our trauma surgeons that I talked about a few minutes ago, but they also do general surgery as well. And then Sue Arford is the nurse who works with ostomies and with wound care within their offices. Howard Head Sports Medicine, we have 10 locations across Eagle and Summit counties. And sometimes we think that Howard Head Sports Medicine is really just all about physical therapy and occupational therapy. So putting our knees and our shoulders and our hands and everything back to work, which is true. But we also have Howard Head therapists who specialize in dry needling, lymphedema, and just different kinds of things not directly related to orthopedic work. Our cancer care close to home, I'm so grateful to the Shaw Outreach team, and I'll talk about that first. We have many people here who were founders, Mary, Susie, and I don't want to miss anybody else who might be here who were founders of the Shaw Outreach team, but it was because of their efforts many years ago, well, 10, 11 years ago now probably, put together a plan to build our cancer caring house, Jack's Place. And it's an amazing 12-room place that allows our cancer patients and their loved ones to be able to stay on site in Shaw free. If they want to make a small donation, that's fine. But because of the Shaw Outreach team and an endowment that they have funded, we don't have to charge any patient for staying during their cancer treatment on the Shaw campus. So that's wonderful to have that. And then our cancer center, our Shaw Cancer Center, was made possible from a wonderful donation a number of years ago by the Shaw family. And it's great because we have 70 people now who work at Shaw. We have top doctors who work there. So Dr. Patty Hardenberg is a radiation oncologist, Harvard and Duke trained. Dr. Alec Urquhart, who is our medical oncologist, he was trained at CU, Denver and Boulder. And we have a tight affiliation, an affiliation with the University of Colorado Health Sciences for assistance in our protocols and our research and clinical trials with the University of Colorado. So that is one affiliation that we do have. And I also would like to say thank you to the Sonnenelt Foundation, because without Rosanna and her foundation, we probably might not have state-of-the-art mammography equipment. But thanks to their wonderful donations, we do have 3D mammography now, and many of us have all used that and can feel very comfortable in knowing that the diagnoses are true and they're right, and that we can rest at night knowing we have state-of-the-art equipment for diagnostics. In orthopedics and research, the Stedman Clinic and the Stedman Philippon Research Institute are partners of the hospital. They're also named by the U.S. Olympic as a national medical center. They're the only U.S. national medical center west of the Mississippi in the United States. And there's only one other designation in the United States. So it means that research is being done, and outcomes-based research, evidence-based research is being done that actually leads to better care and improved outcomes, to getting people back to doing what they want to do, what we all want to do on a daily basis, and not spending a lot of time in rehab or more surgeries. And just one statistic that I heard recently was I think there were 88 elite athletes through the Olympic Committee from international and national who were treated at the Stedman Clinic and through the Research Foundation. 100% of those athletes returned to sport in the year of their surgery or whatever they had, treatment that they had. That's pretty amazing when you think about some of the devastating injuries that our elite athletes have. We also have Vail Summit Orthopedics, a wonderful orthopedic group, and they too have a research foundation. And the hospital is a sponsor and a partner with both of the research foundations to help them with funding to be able to help them propel their research that they do. Total joint replacement, you have heard Dr. Cafferkey and you have heard Dr. Kim speak at one of these meetings. We added the total joint program formally within the last year, but Dr. Cafferkey joined the hospital and Vail Summit Orthopedic Group in 2015. Dr. Matta came from California, and he specializes in anterior hip replacement. These three gentlemen are here working actively, and they're very, very busy with excellent outcomes. And they both work, they all three work not only at the Vail Hospital in surgery, they also work at the surgery center in Edwards and the surgery center here as well. Wonderful addition to our team. As we all get older, we all need something replaced, it seems. And I can tell you, you don't have to look any further than our backyard here. I'm testament to that, as many of you are too. And we have Dr. Ernie Braxton. Don't know if any of you have met him, but he brought in a minimally invasive spine surgery to us last July. He's an excellent, excellent surgeon. And we say minimally invasive. If your type of spine injury that you have falls in the right criteria, you don't have to have a long surgery. They can go in as an outpatient even and fix your back, fix whatever might be going on in your spine or in your vertebrae. And he's excellent. He was the chief of neurosurgery at San Antonio Military Medical Center. So he also, since he's neurospine, he actually helps us with some of our head injury programs and gives lectures, and he can take care of and has taken care of some very drastic bleeds in the head and has saved lives before we've been able to transport patients to Denver. So he's been a very, very good asset to our medical staff. And our family practice partners, Colorado Mountain Medical, where would we be without them? Wonderful family practice doctors, the list in family medicine on the left, our OBGYNs, and then our pediatrics, our pediatricians that serve the community locally, take care of all of us, work on population health management, which is a big term. That means if we stay healthy, we stay out of the hospital. So we're working with Colorado Mountain Medical on this. They also have doctors in ear, nose, and throat, and cardiology and gastrointestinal. We just didn't have enough room on the slide, but most of you know them. But family practice, family medicine partners they're a wonderful group. The Mountain Family Health folks, that's a federally qualified health center. So a number of years ago, back in the late 80s, the hospital started an indigent care clinic for anybody who couldn't pay to come in. And a few years ago, and that was successful, doctors volunteered their time. A few years ago, Ross Brooks, the director of Mountain Family, came to the hospital and said, look, I'm doing federally qualified health centers across the state in Colorado. Let's talk about what we could evolve your indigent care program into. Because as a federally qualified health center, that means they get more money from the government to take care of indigent folks, which means they get reimbursed for all charges for a Medicaid patient, which is truly wonderful. So we combined our services, put it under Mountain Family Health. It's located in our same building in Edwards on the Shaw campus, and they receive free rent from us. We subsidize the service because it is so important to us and as a collaborative effort with our providers in the community that we actually can take care of every aspect of our population. And our volunteer corps, who's here today from volunteers? Where are you? You were supposed to come. You told me you were coming. You told me last week you were coming, Sherry. That's great. So where would we be without our volunteer corps? I can tell you right now, they're doing a recruitment for new volunteers. So if any of you would like to be a volunteer at the hospital and get into the program, I invite you to do that. They do so many things for us, and it's all volunteer work. I'm always amazed when I speak to their group or sit in on their board meetings that they have all this energy around working for free for the hospital and doing it right and getting it right. And whether they're in the emergency department where Sherry spends a lot of her time, or they're up at Beaver Creek in the ER, or they're at our front desk, or they're bringing pet partners in for our patients. They're just a wonderful asset, and we thank them all very, very much. Let's give our volunteers a round of applause. Thank you. So what else do we do in our community? So we've given $13 million a year primarily back to our community in cash gifts or in programmatic gifts. So $69 million over the last 6 years. So charity care, I'll speak to that in a few moments, but we were able to help Starting Hearts in a partnership with them put more AEDs, automatic electronic defibrillators, across the community. We work with the Eagle County School District and EFAC. We so much support Eagle County schools, and we've recently, over the last year and a half, worked with Eagle Valley High School to help them set up a health room that we've donated many dollars to for them to be able to buy school books, health books, to put programs together in anatomy and physiology for students, and we're really, really happy about that. Another thing we've been able to do that's really exciting with Colorado Mountain College is a program. We really want to grow our own. It's difficult to recruit really some niches. So in our OR, nurses, our surgical techs that work right up with the doctors in surgery, we have a hard time recruiting folks. So we said a few years ago to Catherine and folks from Colorado Mountain College, and Rick from our team, Rick Smith, also helped head that up, to how do we grow our own? How do we find high school students, juniors and seniors, who would be interested in going to CMC, learning how to become surgical techs or folks who could work in sterile processing. And you know what? That program's been going now. What, are we in our first class this year? But a tremendous amount of people who've been interested in doing it. And I said, there has to be a little criteria for how people get into the program. They have to be pretty compulsive, like they brush their teeth and they put their dishes in the sink and they make their beds, because you can't work in surgery and not be a little bit compulsive. I can say that because I did that for a number of years, but things have to be in the right place at the right time. So we're gaining success with this program, so thank you to CMC. We're also working with the county and with Mind Springs Mental Health around mental health and behavioral health and detox. It's truly a need in our community. The Eagle County ambulance folks, and I see Pete over here, through the community paramedic program are doing some really neat work in terms of being able to follow detox patients in their homes after a crisis. And it's working in conjunction with our ER doctors. So communities involved in this. We're involved with I think our detox meetings now, there's about 30 of us who sit down, but it's law enforcement, it's the paramedic program, it's county governments, town governments, where we're sitting down and talking about how do we take care of this in our own community. So more to come on that, and especially more to come because you all voted, I'm sure many of you voted for the marijuana tax on growing marijuana and marijuana sales for recreation, not medical, but recreational. So more dollars to come to help us all with that. That was what I was just talking about with mental health. And one thing that's very staggering to me is that there was a study done in 2015 by the Healthy Colorado Kids Coalition. And the outcome of that study showed that nearly 13% of our Eagle County 7th and 8th graders have a suicide plan. Does that just frighten the heck out of you? It really does. There's a new study, Michael Holton, our VP of Communications and Marketing, just told me, a new study coming out in last year's study, 2017 study about to be released. We've got to do something about this with our kids. And the hospital is taking a lead role and seeing what we can do and what drives that. And you know, there's one thing that I'm on my bandwagon about this, because I have two grandsons, 12 and 9, is this constant desire for information. And I'm so thankful to all of you in this room. I haven't seen one person look at their cell phone since I've been here. Now, maybe you're doing it, but I gotta tell you, this instant stuff, and to our kids and our young kids, their egos are so fractured so fast by somebody writing something naughty in a text message or an email to them that it makes kids lose their self-confidence. That's one area. We've got to work on when kids have access really to that kind of situation, or they can, it's just the media, the stuff they can get into online is just mind-boggling to me. We have a responsibility. So that's one thing that we're taking a stand on here. The cost of healthcare, well, you all tell me it's too expensive. I agree with you. I want you to understand one thing, that hospital healthcare dollars and healthcare spending makes up only 32% of the healthcare spend in healthcare. Hospital charges only is 32%. So you have pharmaceuticals, which is under fire constantly on how much the pharmaceutical companies actually spend or charge us for our prescriptions. So we have been very cognizant of this over the last 6 years. And so we have raised prices on an average of 3% or less on an annualized basis across our organization. While the national average of raising prices has been in the 7 to 10%. Hospitals, there was a day 20 years ago when you could raise prices every year just because you could. We can't do that now because people can't afford it. And we have a hard time in this community, but some folks do, in being able to afford affordable healthcare here. I can tell you that the Affordable Care Act did very little to help many of us. And here's what happened with the state exchanges. So we said the state exchanges came out, and I think initially it was Anthem Blue Cross and Kaiser and a couple of other, Aetna I think was involved as well. And they said, buy our plans, it will cost you less. So several 100,000 people signed up in Colorado for these plans. Well, here's what happened. The healthy people didn't sign up. And that was what the whole Affordable Care Act was based on. You have young people sign up, they pay in premiums into the health plans, they pay premium dollars in on a monthly basis, and they're healthy. They're never going to use the plan. Great, so we take all those premium dollars they've paid in, move them over to the bucket where people who haven't had health care insurance for years or ever, and they sign up for health care, and they have tremendous amount of needs. So surgeries, diabetes, different cardiovascular disease, congestive heart failure, diabetes, they get the treatment then, and it's very, very costly to get that treatment. So this bucket over here, the healthy people didn't sign up. There's no money here. This bucket over here is drained, totally drained. And so the health insurance companies quickly dropped out of the exchanges across the country, not just in Colorado. But you don't see Anthem Blue Cross anymore. You don't see Aetna. You don't see United. So we're left in Colorado, in our region, with Kaiser. And there's several different things we could talk about Kaiser, and I'm happy to talk individually with you about that. It's got some good plans and some good things about it, but we've done this to ourselves in terms of what has happened to nationalize healthcare. And it's not going to get better unless our partners in Washington, D.C. decide to help us all do that. And we need help to do that, even in our state legislature. And actually, I have a part-time lobbyist, well, very part-time lobbyist in the state of Colorado, just to help us out with what kinds of things are coming in our state health legislation. And we've been very successful in being informed in the mountains and rural healthcare and where we want to go and then what happens next with it. So we have to all work together, but know that this hospital has only raised their prices 3%. And we have to cover costs because our supply costs, so those, when you get a total joint, those metal things that go in your knee or your hip, those suppliers charge a lot of money for those. And so we have to negotiate and balance out what we can afford because our doctors know what works best, and we all want what our doctor thinks is best. So we're constantly battling, what are we going to do with the cost of healthcare, and how do we work together with our vendors, with our suppliers, with our doctors in getting the best of the best at the best prices so that we can pass that pricing off to all of you. So our charity care. So available to our households earning up to 350% of the poverty level. So somewhere between 4 or 5 people in a family, between $80,000 and $100,000 a year, qualify for charity care at our hospital. Some hospitals go up to 400% of federal poverty level. Most of the hospitals in Colorado are around the 250 to 300%. But we believe that in our community, we have to do something to help out our folks who are uninsured or can't pay their whole medical bill. So we have a team of people in financial counseling that works with folks who come into the hospital, with patients and families. And our urgent cares that the hospital owns, so the one I talked about in Avon by City Market and the one in Gypsum, we give a 75% discount to anyone in Eagle County who do not have any type of health insurance. We don't ask them for tax returns. We don't ask them if they're citizens. We just say, if you'll sign on this line that you don't have health insurance, we'll give you a 75% discount. It's working for us. It's doing, because we believe that if people are sick, they need to come in at the earliest possible time and not wait until it's a catastrophic event and they're really, really ill. So that's working. And then we can refer these patients off to our partners in healthcare to help them get longer-term care if they need to do that. We've reduced our self-pay prices across the board, and we have no interest payment plans so that folks can sign up for it. And again, our financial counseling team, headed up by Harold Duber, who's our CFO, he's sitting in the back. You can talk to him afterwards if you'd like about some of these financial plans that we have. But I want you to know we do a large amount of charity care on an annualized basis. It's several $million. So from a legislative update standpoint, I spoke about the federal group. The Colorado group, we're monitoring what bills are there this year. There's not a lot that's come forward, and part of that is because there's so many people who's jumped into the gubernatorial race that no one who's currently in the legislature wants to get too controversial. But that's really my take on it. So some of the things they're looking at, which is really key, this opioid and substance abuse disorder bills. There are some really key things, and our hospital has physicians in a committee and also our clinical leaders who are participating on a state level through the Colorado Hospital Association to look at some of the things that we can help do in our community. So some of the things that can happen is, say when you leave hospital after surgery, how many of you don't have to tell me, but got a prescription for some kind of opioid or narcotic that was for more than 7 days? Yeah, I'm in that boat too. There's not that, there's only less than 3% of the healthcare population of people. So I'm a patient, I get the opioids. It's not me that's getting addicted. It's other people or family members or people or who you hand off or you sell them to, not that anybody in this room would do that, but that's what's happening across our country. So if we can limit that prescription to 7 days, you can always call and get a refill if you're having that much pain. But we need to work on limiting that. And I agree with a bill that would say that in the state of Colorado. And then alternatives to taking pain medication. Who wouldn't like that better? So really reimburse people for acupuncture and some of these alternative methods I think would be really good. Even physical therapy for pain. If your joint gets stiff, you're going to have more pain than if you actually keep it working. And then the regulation of freestanding emergency departments. We don't have a lot of that happening in the mountains. But in Denver, near the hospitals in Denver, there's almost an emergency facility on every corner. So UC Health has them, Centura has them, Health One has them. And the real reason for that is that if you go into one of those on the corner freestanding facilities and it's an emergency and you need to go to a hospital, guess where you're going to go? You're going to go to the hospital that actually sponsored that ER. And those have cropped up all over Denver. And I'm told we need to regulate that. I don't play in that arena because we don't have those huge issues in the mountains. But that's an issue that the state legislature is looking at. And then trying to make all pharmacies be a network. How many of you have different pharmaceutical plans? And you have to call and find out, what's my copay? What do I have to pay on an annual basis? If the state of Colorado would mandate that all pharmacies are a network across the state, that would speak loudly for everyone in the pharmaceutical business and also us as patients. So I won't go into all of the things here, but we've done some good things lately with just some of the nurse practice acts across the state of Colorado. So switching gears to the master facility plan, and this is the last chapter of what I'm talking about today. Many of you have heard me talk over the last few years about what we're doing and where we're going and progress. So I can tell you today that the West Wing is complete, and it was completed in 2017, West Wing and Central Wing. And it was completed on time and on budget. So that's a testament to our Project One partners. I think Chris is here. and Steve, and our work with G.E. Johnson and our design folks with Davis Architects. So that was really good. So the East Wing project, it's going to be completed in December, the fall of 2020. That sounds like a long ways, but when you were in 2015 looking to 2020, it was a long pathway. Now we're starting on the East Wing. So we're growing from an increased size in order to accommodate patients. Sometimes people ask questions, well, why are you doing this on a postage stamp in Vail, land-wise? Why aren't you down valley? Why didn't you buy a nice piece of land and move it? Well, that was contemplated back in the 2008-2009 timeframe. However, when you really looked at building a new hospital down valley, you had to leave segments of the hospital here. So for trauma, for instance, Dow Junction goes down, there's a trauma on Vail Pass. Ambulances can't get through to go to that nice new hospital down valley. We've got to take care of the patients here. The majority of our patients at that time were actually coming more locally here and off of Vail Mountain. Skiing's not a dangerous sport. I'm not saying that, so don't tell Rob Katz that I said that. Nobody text him right now and tell him. I'm just saying there's significant trauma. So we would have had to have replicated our operating rooms, our emergency department, and our ICU, and all the staff that it requires to take care of those patients. So we couldn't really do that. So we worked with the town of Vail, who said, we want the hospital to stay here. We want the hospital to be here. So what we did in 2009, when many of you participated in the survey, that you wanted more accessible care, but it didn't have to be hospital accessible care. So out of that study, we kept the hospital here in Vail, but we opened up the urgent cares in Avon, the urgent care in Gypsum. We added more services and surgery center capability at Shaw, opened up on the Shaw campus, and worked with our partners for more clinical clinics up and down the valley to make that accessible and convenient care available to you all on a more regular basis. So the hospital stayed here for the key reason of not being able to afford to duplicate services. When you talk about not just people, you talk about equipment, and operating rooms are very expensive to outfit. So in order to meet the needs of the community, we made the decision, the board made the decision to stay here. So this is a list of all the things that we're getting out of our master facility plan. This is a picture. It's a preliminary concept, but it has been approved through the town of Vail, through the design review, through the Planning Environmental Commission and the town council. So I'm very grateful. And Cliff, our new town manager, sitting in the back, thank goodness he wasn't here to have to go through all of this with us. But anyway, I'm very grateful to our town government folks who actually assisted us very nicely to move through this project. So the street that you see right here, that's the south frontage road. So when we're finished in 2020, the new entrance will be here. This is the brand new entrance to the hospital. The helipad moves from across the street somewhere over here to an elevated helipad, which from a design standpoint and a pilot standpoint, and we worked with all of them, consultants, national consultants who work with the FAA circular, and also folks who, pilots who come in and out of here at altitude. What's the safest for our community on the ground and safest for the patient and for the team on the helipad, on the helicopter leaving? And it was an elevated pad. So we worked on all kinds of things called FADOs, flight approach and takeoff areas. I'm not telling you I know all this stuff. I just learned it through the process. But really worked hard in what the airspace is around here to get a helicopter in safely and get it out safely. And so we were able to accomplish that with this building. And initially we talked about just something that looked like this with a helipad on it. And then there was a discussion, maybe we need more space to put more people. So today we're working with the ambulance district for ambulance garage here and living quarters here, not finalized on that piece yet. But ambulances will come in here, drive in here, no matter where we get with the ambu district. But we'll be able to unload patients and go directly into the ER here. And it's very exciting. The Borgen family has worked with the hospital to make a wonderful donation that will support the emergency center. So look for more of that information to come. So thank you to the Borgen family to help with that. Yes, Kathy said they chose that to sponsor because they have used it a lot, so thank you. And many of you in the room have donated many dollars to our foundation efforts with our capital campaign. I'm not slighting you, thank you. I just happened to think of Kathy and Eric when I was looking at the ER. And then there'll be a drop-off area for the emergency department here. So then this is just, again, another way. That's the same. You come up here, you get to the front. There will be valet services here, and maybe it showed it better on the other one. So the other place to come in, we have a new parking structure. So if you don't come and drop off here, you can come down through here and enter a parking structure, a 3-level parking structure. And that'll be nice. We'll have valet and concierge services at each level to help direct you where you're going. This is Meadow Drive. So this is the Meadow Drive view. And so this was the new front lobby, the new entrance over here. This is all lobby area, and I'll show you interior in just a couple of moments. We have a nice deck here, a little higher railings going to go on there too for safety purposes. But one of the things when we started our master planning was to get all vehicular traffic off of Meadow Drive. So we worked really hard to be able to do that. What we haven't been able, or wasn't able in the planning to get off, was our loading and delivery area for supplies. But we were able to conceal it. It's a drive-in, turn around, back up, doors come down. So we've taken up that beep, beep, beep that you're backing a vehicle up on Meadow Drive. So that's gone when this is done. Vail Summit Orthopedics physicians will be on this floor, level 2, one floor below the hospital lobby. So lots of good things happening in this area. This is just another view looking toward that south-facing side of the hospital, the doors going in and coming out for loading and delivery. Trash will all be inside. We've limited the number and the size of trucks going forward. We started that a couple years ago. What comes down Meadow Drive today? So we have staging off-site, just-in-time delivery. We collapsed and consolidated. We had an event with hospital employees. Do you want Coke or do you want Pepsi products? We can't do both, the trucks are too big. So we did a vote, and I don't drink them, so I don't know what won. What won? Somebody tell me. Coke? Coke won. Yeah, okay. So anyway, we tried hard to get our employees involved, and they were. This, as you come in that front door, so you've come down Frontage Road, you've come in the front door of the hospital now. Immediately, this is what you see. You see a new front desk. You see a beautiful new gift shop, and the retail pharmacy right behind it. And on the left is a full-fledged Starbucks. So doing some fun things here to help with visitors. And then you can see that we wanted to create this. You can see the outdoors once you walk in the front door. So you can see through to glass, and you can see the beautiful mountains out here on this side. Now think that you have walked through here now to the other side, and this is the other side of the lobby. So on the side of Meadow Drive, where the bus stop is, there's another walk-in entrance with an elevator that will bring you up to the 3rd floor or to the 2nd floor to Vail Summit Orthopedics. But this is what the other side of that lobby looks like. And I think this is pretty much what the design is in terms of colors and textures. Furniture package we're not finished with, but have had some real good input from patients and visitors and folks on what that will be. So this concludes my talk. We are here for you. We are here for you, the community. My door is always open to any one of you. Some of you have been in my office and we've talked. I've come to you. We've had lunch. I welcome conversations with you about the healthcare in this community, about the healthcare in the state, and about your personal healthcare. If there's something I can help with, they don't let me look at medical records anymore. I don't have a need to know, but I know people who can help you out if you have questions around those things. So we really are here for you, and we want to continue to serve you in the best healthcare way that we can on behalf of the board and our executive team, our employees, our doctors, and all of us. So with that, in place of questions, because there can be so many and people can't hear questions and answer, I'm available up here to talk with you. We have over here on this side of the room a station set up for you to look and ask questions about the master facility plan, about the service lines that we have, some specific questions if you have them around Howard Head or around the Shaw Cancer Center. We have experts who can probably answer some of these questions better than I. So thank you all so much. I really appreciate your time. Thank you.